9:25, welcome back. This is Ask the Expert with Duchesne and Portois Dental Center. Dr. Michael Portois is here to answer your questions this morning. If you do have dental questions, why wouldn't you get some free dental advice while we're sitting here? Seems reasonable to me. 613-789-6559, extension 2803. Email us, Facebook us, all that business. So get your questions in. We're going to explore even more of the world of dental x-rays, as it were, and some of the things that are being done these days. It's got to be, even since you've been in school and as a practicing dentist, there's got to be some great advancements in the world, eh?
One of them is, I'll just move this slowly, CAT scans. This is the old CAT scan machine.
That's a CAT scan machine.
Yeah, you'd think.
And a CAT scan, for people who don't know, is, well, that looks inside your head.
Yeah, but it's x-rays.
Yeah.
You got to realize
it is x-rays.
It is x-ray. Similar looking machine is MRI. Magnetic resonance imaging. Well, in the past they would say, well, having an x-ray machine in a dental office is unheard of. It never happens. Now we're in digital x-rays, which is a lot less, and now we're even looking at CAT scans in the dental office.
So this is a whole setup here?
This is called the iCat, and you just sit in it, and that turns around your head, and it takes a CAT scan of you.
Oh, the whole thing circles your head?
Yeah, just like a panoramic x-ray.
Okay, now, do you have that?
No.
But it's in the future?
It just got, every province was allowed to have this except Ontario until about a month or two ago.
Oh, okay. So maybe something you get in the future?
Might. Right now it's pricey, but
well, yeah,
it's to think of the future.
Cheap.
Yeah. It's not cheap, but it's good technology. And the images you get, you expose your patient once, and then you get a 3D view of everything. So now if I want to see a cavity, I could see everything.
So all of this
I want to place an implant, one scan.
One sitting.
But it's a lot higher x-ray exposure. So go one step further. MRIs, they've come out, 10, 15, 20 years ago, and they're improving and getting cheaper. Before you used to have one MRI per city or per 2-3 cities. Now you have like 4, 5, 6 in a city.
But still it takes a long time to get in.
It takes a long time. But x-rays were the same thing years ago, and CAT scans. Now you're getting CAT scans available in dental offices.
Yeah.
And say before I retire, maybe 20 years from now, maybe we're going to have magnetic resonance imaging, which is no x-ray exposure.
In your office.
In your office. Why not?
I can see that happening, and we can all see that coming down the road, because it's a lot like any sort of technology. I mean, we often talk about televisions, for example, flat screen television. How long ago was it that they just started coming out? Wasn't that long ago?
How much did they cost when it came out?
Oh, the first one I paid for was 42 inches and $3,500, right?
Oh, yeah, that was
and
cheap.
now you're paying under $1,000 for that sort of thing. You're paying $700.
Exactly, and
so
you're getting the quality is higher too.
Yeah, and it's the same sort of technology advancement.
Exactly.
Right?
X-rays, when they first came out, they were beaming you with a whole bunch of stuff, just like the old TVs weren't as good, and now they're getting more precise, clearer images, less X-ray exposure.
Well, like
now we get into CAT scans. This is higher. Now it's in the future we're going to get MRI, which is no X-rays.
Yeah. Look, I'm no dentist, Michael, but I can see that this is full of information for someone like you.
Exactly, especially if you're placing implants, you don't want to be in vital structures.
It gives you a look at the jawbone. It gives you a look at,
sinuses.
Everything.
Because there's a lot of lesions that happen in the sinuses. And there's a lot of lesions that happen in the bone and stuff like that. So.
That would be helpful to you in what you do.
Exactly.
And you get you take one set of pictures, and you get all kinds of information.
Yeah. Depends what you want to get. A full scan is a lot of X-ray exposure. Usually we'll do one segment, but you're getting a lot more information and less exposures, because an X-ray you'd have to take 4 or 5 to get the same information as that.
Right.
So you got to take. I don't want to bring this in and say that this is less exposure. It's not. I'm just saying look towards the future. There'll be other things coming. Right now the X-ray exposure is a lot less than what it used to be, and that study's a little bit false.
Does the dental association, groups of dentists, try and work to get these things available to people?
Well, the iCat was a big battle in Ontario.
Like, why not Ontario? Was there any reason given?
Well, that was a fight between two colleges, the College of X-ray Technicians and the College of Doctors, the medical college, because they didn't want dentists to be taking these, because radiologists should be taking CAT scans.
Right.
Every other province was doing it except here. So it's one of those things. Ontario is one of the strictest provinces to bring anything new in.
I really get that impression from
very, very difficult.
Other circumstances, that's for sure.
Yeah. Well, it's good in a way. They're protecting you.
Well, yeah.
they're doing their
making
job.
sure things are
Yeah.
good to go.
But
And that's a positive.
Yeah, those very colleges that are protecting you also, as soon as that report came out on the news a few weeks ago saying that you're exposed to a lot more x-rays and there might be tumors related to it, they sent publicities out to the dentist trying to explain and saying, listen, this doesn't make sense, this study, because they did it from memory, not from truth.
Yeah, and that's one thing to keep in mind, no matter what the study is, it's not necessarily the absolute truth.
Yeah, you got to look at several studies. You can't look at one and say that that's all-knowing, because there's always another side, and you got to look at both sides of the story.
One more segment to go. Still a chance for you to get some, we haven't had any questions yet, we do have some coming up. Give us a call, 613-789-6559, extension 2803. Email us, ottawa.morningcdb.ca. You can Facebook us a question. Just get your questions in for Dr. Michael Portois from Duchenne and Portois Dental Center here on Ask the Expert. We'll be right back. Oh, here's where to find the Good Doctors Dental Center. It's in Stittsville on Main Street. Not hard to find at all. Go to their website. Check it out. We'll be back with more after this.